Hi, my name is Carla Nettles, and I'm here today to talk to you about schizophrenia. I am going to describe the symptoms, the age of onset, and the causes of schizophrenia. If I ask you today, would you know what schizophrenia is? Do you know someone suffering from delusions, or out of touch with reality, or catatonic, or disordered in thinking? You may not now, but what if schizophrenia affects your family or a loved one later in life? Schizophrenia crosses all socio-economical, cultural, and racial boundaries. Schizophrenia is a serious mental illness, and knowing the signs, symptoms, and age of onset will assist in getting the correct help and diagnosis. Schizophrenia is a long-term illness affecting 1% of the United States population. Knowing the difference between drug-induced schizophrenia and schizophrenia, the illness, could save a loved one, maybe your child or someone you know. The main points I would like to discuss with you today are age onset, symptoms, and causes. The age onset, the average onset of schizophrenia in males usually occurs between the late teens and early 30s. Women tend to show signs between the 20s and early 30s. However, schizophrenia can occur at any age. Although it is unlikely for children under the age of 12 or someone over the age of 40 to be diagnosed with schizophrenia. Worldwide, schizophrenia affects about 33 to 75% of individuals with onset in the late teen or early 30s. The age range of onset differs in people. However, the symptoms of schizophrenia do not. Furthermore, symptoms can be hard to diagnose in adolescents due to adolescent behavior. Symptoms such as hallucinations, delusions, negative symptoms, cognitive issues, and disorganized thinking are these symptoms of schizophrenia. Could you imagine seeing these images in your head? And these are images that people see with schizophrenia. These are voices that they hear. That could be several different people that they hear in their brain. Not all good and not all bad. So these people are telling her what to do. That's what you see, or that is what a person affected with schizophrenia hears inside their head. Cognitive issues and disorganized thinking. People with schizophrenia have a lack of insight, and that means they are unaware of their illness. Due to lack of insight, it is challenging for people with schizophrenia to get help. We have discussed age onset, symptoms, and now we'll look at the causes of schizophrenia. Although the theories of origin of schizophrenia, most theories center on biochemical, genetic, environmental, and psychological causes. A rough estimate of 10% of people with first-degree relatives having the illness, such as a parent or a sibling, are more prone to schizophrenia. Chromosomes. And what are chromosomes? Chromosomes are a package of tightly coiled, condensed DNA. Each chromosome is tightly coiled around proteins called histones. And this makes up your chromosomes. Chromosomes 6 and 22. Chromosome 6 is responsible for the thought process. And that is the chromosome that is affected by schizophrenia. This is your neurons in your brain, and those are also misfiring when you have schizophrenia or been diagnosed with schizophrenia. Rare inherited genetic mutations occur 3 to 4 times more in people with the illness than healthy people. Exposure to chemicals or malnutrition before birth in the first or second trimester can cause schizophrenia. Inflammation or autoimmune disease before birth, mind-altering drugs or substance abuse in adolescents and young adults increase the chance of schizophrenia. In conclusion, schizophrenia is a serious mental illness. The signs, the symptoms, and age of onset assisting you in getting the correct help and diagnoses. The main points discussed with you today: age of onset, symptoms, and causes. Illegal drugs can induce schizophrenia-like behavior and make it difficult to diagnose the illness. Lack of insight also complicates the treatment. There is no single lab test that can diagnose schizophrenia, but a healthcare provider over a 6-month period of time can ensure the diagnosis. I appreciate you being here with me today, and if you have any questions, please let me know. Thank you.